To Mbale City now, where stakeholders in Mbale City are worried over bars that adolescents and young women freely access and are prone to catching HIV/AIDS. Led by women with the MUHAMMAD-UBC and Mbale network of people living with HIV, they say that there are increasing numbers of new infections among adolescents and young women due to failure to access health services.
UN AIDS statistics show that there are over 60 new HIV infections in adolescent girls and young women due to failure to access the required services. The Executive Director Women with a Mission Uganda, Betty Balisalamu, says adolescent girls and young women need information on HIV/AIDS spread and prevention.
Some of these don't know how to use condoms. So we are here to give them the information where they can access those services, but also identify those issues which affect them.
The 2020 Uganda Population-Based HIV Impact Assessment shows that the prevalence of HIV/AIDS among adults aged between 15 to 19 years in Uganda is 5.5%, whereas the national prevalence rate is at 6.4%. This prevalence among adolescent girls is attributed to the COVID-19 outbreak.
Increased due to the COVID lockdown, but also post-COVID lockdown. Why? Because it was very hard to access SRHR services and HIV services, because the Ministry of Health or the health centers were mainly concentrated in giving COVID-19 services.
During a consultative engagement with the youth and young women in Mbale City, the youth cited barriers to access of HIV/AIDS services as information gap that leads to ignorance on the preventive measures.
Before having sex, that you wash your private parts with cooking oil or with soda that you don't contract. You very well know that these things are there in the community and people really follow them. So these things are a very big limitation to adolescents or anyone ignorant to receiving the services that they really need.
A staff at Mbale network of people living with HIV/AIDS, Peter Mweru, said in Uganda 250 girls contract HIV/AIDS every week, and in Mbale, girls start engaging in sexual intercourse as early as 15 years and below.
Girls start playing sex at the age of 15. Also, if you look at the knowledge of condoms for these young girls, it is only 3.8. As young people have information that condoms prevent pregnancy. That's the most important thing. But also condoms, we call it double protection. It gives double protection in a way that it helps you prevent HIV as the first thing, but also it helps you to prevent pregnancy.
The adolescents told UBC TV that they were ignorant about HIV/AIDS preventive measures and affected by stigma and rude approach by health workers.
nga balina okuwedagala omusawo nakugamba gwakaana akato wanoonya ki mu basajja kyovola wafuna ki sirimu ate ng'oluusi tewamufunira mu basajja kati abasawo mu malwaliro bakambwe nnyo erifa abaana naddala abantu abalabika obuto.